As we know that autonomic nervous system is divided into two major branches, the parasympathetic nervous system and the sympathetic nervous system. So the drugs that act on the sympathetic nervous system and mimic the effects of sympathetic nervous system are called as sympathetic drugs, or they're also called as adrenergic agonist. Agonists, they're called as agonists because they mimic the effect of sympathetic nervous system, and adrenergic because the receptors of sympathetic nervous system are called as adrenergic receptors. Sympathetic nervous system is best known for its role in responding to dangerous or stressful situations. In these situations, your sympathetic nervous system, it activates to speed up your heart rate, to deliver more blood to the areas of your body that need more oxygen. And those areas include your muscles and all the vital organs, and also it mediates other responses that help you to get out of danger. That is why sympathetic nervous system is also called as fight or flight response. We have three major endogenous catecholamines of the sympathetic nervous system, and these are dopamine, norepinephrine, and epinephrine. So the biosynthesis is that we have an amino acid tyrosine, which is converted into dopa by the aid of an enzyme which is called as tyrosine hydroxylase. This enzyme, it facilitates the conversion of tyrosine into dopa. Now dopa, it is an intermediate which is then converted into dopamine by the aid of an enzyme which is called as dopa decarboxylase. This is then converted into dopamine, which is our first neurotransmitter of the sympathetic nervous system. Dopamine is converted into norepinephrine, which is our second endogenous catecholamine, and epinephrine is converted into norepinephrine is converted into epinephrine by the enzyme phenylethylamine N-methyltransferase. And this is how the biosynthesis of endogenous catecholamines, it occurs in the body. We have three kinds of adrenergic receptors in our body. I have also made a different video on the receptors. These receptors are alpha, beta, and dopamine. We have two subgroups of alpha, alpha 1 and alpha 2. In the beta, we have three subgroups, beta 1, beta 2, beta 3. And the dopamine, we have D1, D2, D3, D4, and D5. These endogenous catecholamines, they interact with all these receptors in the body and produces the effect. Now the alpha 1 receptors, they are present mostly in the smooth muscles. The alpha 2 receptors, they are present in the presynaptic adrenergic nerve terminals. They are also present in the platelets and the smooth muscles and the lipocytes. Beta 1 receptors are majorly present in the heart and the kidney. It is also present in the ciliary body epithelium, in the brain, and in the lipocytes. Beta 2 receptors are also present in the cardiac muscle and smooth muscles. Beta 3 receptors are present in the heart and the lipocytes. Now the dopamine, in the dopamine we have 5 kinds of receptors, and all these are present in the brain and some effector smooth muscles of the, let's say, the dopamine 1 receptor, it is present in the smooth muscles of the renal vascular bed. So these all receptors, they are distributed throughout the body, and these endogenous catecholamines, dopamine, norepinephrine, and epinephrine, they bind with these receptors and they produces the so here we have a schematic diagram of the generalized noradrenergic junction, and we have already discussed the biosynthesis of the adrenergic neurotransmitters. So here we have this tyrosine. This tyrosine is converted into dopamine. The dopamine is then converted into dopamine. This dopamine is then transported into the storage vesicle, and the storage vesicle, from the storage vesicle, it fuses with the wall of the nerve terminal, and the norepinephrine is released in the junction. Now in this junction, these are the postsynaptic cells, and the membranes of these cells, they have the adrenoceptors which we have already discussed, the alpha, beta, and the dopamine receptors. This norepinephrine, it binds with these receptors, and the binding will produce the effect. Now let's discuss that what kind of effects are produced in the body when the adrenoceptors are activated. So this is the diagram which I have added to make the understanding to make it more understandable. To start organ wise, in the eye we have alpha 1 receptor, and the activation of alpha 1 receptor, it causes the contraction of the iris circular muscles. And the response that is produced by the contraction of muscles, it will cause the mydriasis. Mydriasis is the dilation of the pupillary muscles. We can see that here in this diagram, we can see the mydriasis. So after the eye, we have here the lung. In the lung, we have beta 2 receptors. And these beta 2 receptors, upon their activation, they relaxes. And when these receptors causes the smooth muscles of the sympathetic nervous system to relax, the effect produced is bronchodilation. After the lung, we have heart. In the heart, we have beta 1 and we have beta 2. So whenever these receptors are activated in the heart, they produces a positive chronotropic effect and positive inotropic effect. Chronotropic means the heart rate will go up, and the inotropic means the force of contraction will go up. That it will increases the activation of these receptors. They will increase the heart rate of a patient, and also the force of contractility in the human. So after this, we have after the heart, we have liver. The liver has beta 2, and it also has alpha receptors. In the liver, the activation of beta 2 and alpha, it causes the gluconeogenesis. And as the name indicates, gluconeogenesis means the genesis is the production, neo means new. So gluconeogenesis means the production of glucose, and glycogenolysis. So lysis means the breakdown. So we break down the glycogen. Glycogen is reserved in the body, and it is break down to produce more glucose in the body. So we get a higher level of glucose in the body, in the blood. So after the liver, we have the gastrointestinal tract. In the whole gastrointestinal tract, we have two places where the muscles are present: in the walls of the GIT and in the sphincters. So in the walls, we have alpha 2 and beta 2. And in the sphincters, we have alpha 1. So whenever the sympathetic nervous system is activated, the walls, they are relaxed, and this relaxation is mediated by the beta activation, and the sphincters are contracted. So the motility of gastric overall GIT, gastrointestinal tract, is decreased. So after the GIT, we have genitourinary smooth muscles. We have the bladder. In the bladder wall, we have beta 2, just like the gastrointestinal tract. So the wall, it relaxes upon activation, and the sphincters, they have alpha, they contract. And after the we have reproductive organs in which the uterus is present in females. So in the uterus, the walls, we have beta 2 receptors, and these relaxes, upon the activation. So, and in the skin, we also have skin in the body, and in the skin, we have alpha receptors, and they contract in response to the stimulus. So these alpha receptors, they are present in the palomotor smooth muscles, and as a result of this, we have goosebumps. That whenever we have our sympathetic nervous system is activated, we have goosebumps. So the receptors that are working right there are alpha 1 receptors. So let's recall it. In the eye, we have alpha 1 and the contraction of the radial muscles. In the pupil, this causes the mydriasis. Mydriasis is the enlargement of the pupil size. We have in the skin, the alpha receptors are present in the palomotor cells, and upon their activation, it will be contracted. In the lungs, we have beta 2 receptors, and the effect of sympathetic nervous system activation is bronchodilation. In the heart, we will have an increase in the heart rate and the increase in the force of contraction. In the liver, there will be an increased production of the glucose. As a result, in the GIT, we will have decreased motility of the GIT. The walls will be relaxed and the sphincters will be contracted. In the bladder, likewise, the gastrointestinal tract, the walls will be relaxed and the sphincters will contract. In the uterus, we have beta 2 receptors, and they relaxes upon the activation. So this was the preview of the organ system effect of the sympathomimetic drugs. Now we have the classification of the adrenergic receptors. They are classified into two major groups: the direct agonist and the indirect agonist. Direct agonists, they will directly bind with the receptor, and they will produce the effect. These are the indirect. They will displace the stored catecholamines and will mimic the effect of the adrenergic receptors. And the second class of indirect agonist, it has the drugs that inhibits the reuptake of catecholamine that is released in the junction. So this junction, when the norepinephrine is released, it is also taken by this norepinephrine transmitter into the cell again. So this is blocked by the indirect agonist. So once this receptor is blocked, there will be an increased concentration of norepinephrine in the junction, and this is how we have a more pronounced effect of norepinephrine in the body. So the three endogenous neurotransmitters of the adrenergic receptors, these are epinephrine, norepinephrine, and dopamine. They directly bind with the receptor and produces the effects of the sympathetic nervous system. Epinephrine, norepinephrine, and dopamine. Epinephrine, it binds with both alpha and beta receptors. It is a direct cardiac stimulant. Cardiac stimulant means that it stimulates the heart and increases the rate and force of contraction. It has a positive iono and positive tonotropic effect. It produces bronchodilation by binding to the beta receptors in the lungs, and it is secreted by the adrenal medulla. Norepinephrine, it binds with alpha 1 and alpha 1, alpha 2, beta 1, beta 2. Both are receptors, but the beta 2 activity is a little less as compared to the adrenaline. So it binds with alpha receptor, so it causes an increase in the peripheral resistance. And this is mediated by the vasoconstriction. It increases the blood pressure. So does the epinephrine. It also increases the BP as it is a cardiac stimulant. So it also has a positive inotropic and positive phonotropic effect. The dopamine is a precursor in the synthesis of norepinephrine. It also regulates the sodium and water excretion. It is a major neurotransmitter in the CNS, and it plays a role in the reward stimulus. Its deficiency, it leads to different diseases, including Parkinson's disease. So here we have some drugs that are direct acting sympathomimetics. Direct acting sympathomimetics means that they will directly interact with the receptor and will produce the effect. It has phenylephrine, hydroprine, clonidine, methyl-dopa, guanfacine, guanabenzine, dexmedetomidine, oxymetazoline, tizanidine, epaclonidine, brimonidine, and dexmedetomidine is again here. Let's just remove this from the here. So we have phenylephrine. It is discussed as a pure alpha-1 agonist, and if we recall, the alpha-1 agonists, they were present in the smooth muscles of the blood vessels and the sphincters, so it causes the vasoconstriction. It is also used as a decongestant because it activates the alpha receptors and causes the contraction of the vessels. It is also used as a mydriatic agent, which means that it is used to increase the size of the pupil, and when the size of the pupil is increased, the ophthalmoscopic examination is more easy or more convenient. The second drug is midodrine. Midodrine is also a alpha-1 agonist. It does not have any effect on the beta receptor or alpha-2. The primary indication of midodrine is used to treat orthostatic hypotension. We have clonidine. We have methyl-dopa, gabapentin, and gabapentin. All these are alpha-2 agonist, and the activation of alpha-2 agonist has a negative feedback response, and it decreases the activation of alpha-2 actually decreases the concentration of norepinephrine in the presynaptic junctions. So the alpha-2 agonist activation, it causes a decrease in the blood pressure. So all these drugs, these are used as the antihypertensives. Methyl-dopa is a very famous drug which is used to treat hypertension in the pregnant females. We have oxymetazoline. Oxymetazoline is used as it is a direct alpha agonist, and it is used as a topical decongestant in the nasal sprays. Tizanidine is also it is used as a muscle relaxant, and it is an alpha-2 agonist. We have epaclonidine and brimonidine. Both these drugs, they in the treatment of glaucoma. Dexmedetomidine is an alpha-2 agonist, and it is used in the ICU setting for sedation. When the patients are intubated or if the patients are very anxious. So this was a little overview of the direct acting sympathomimetics. They will directly interact with the receptors and produces all these effects, and they have these clinical applications. In the indirect acting sympathomimetics, we have amphetamine, methamphetamine, phenmetrazine, methylphenidate, modafinil, atomoxetine, reboxetine, sibutramine, duloxetine, milnacipran, and we have cocaine. So amphetamine, it is a displacer. It is a catecholamine displacer. It will displace the catecholamine and binds with a greater efficiency with adrenergic receptors and produces the effect. Amphetamine is used as a CNS stimulant in the patients of it has a positive impact on the mood and alertness. It also decreases the appetite, so it is used for the treatment of children with attention ADHD, attention deficit hyperactivity syndrome. The methamphetamine is a derivative of amphetamine. The phenmetrazine, it also uses anorexia, which is used to decrease the appetite in the humans. Methylphenidate, it is also used in the treatment of attention deficiency hyperactivity disorder. The phenmetrazine, it is used as anorexia. Modafinil is used in the treatment of narcolepsy. In this condition, the patient sleeps in the day. The atomoxetine, it is used. We have free uptake inhibitors in these. We have all these drugs. Atomoxetine is used in the treatment of ADHD in children and in adults. The reboxetine is also used in the same indication. Sibutramine is used as an appetite depressant. It was used. Now it is not currently available in the market. It was used in the treatment of appetite depressant, and due to its CVS disorders, it is now off market. The serotonin duloxetine, and it is used as an antidepressant drug. The Nasipran is used to treat severe pain in fibromyalgia, and the cocaine, it is used as a local anesthetic, and it resembles the effect of amphetamine. Amphetamine, which is a sane stimulant, it has a positive impact on the mood and alertness. It also decreases the appetite. So this was a brief overview of the indirect acting sympathomimetic drugs. Now we will discuss the clinical uses of these drugs. As a mydriatic agent, as we can see that the size of the pupil in this patient is increased. This is a phenomenon of mydriasis, and when the size is increased, it is more easy or more convenient to examine the retina. So phenylephrine is used as a mydriatic agent. It is also used as a decongestant. And what happens is that, but when the size of the pupil is increased, it is more convenient to look inside and examine the retina. They are also useful in localizing the lesion in Horner syndrome. Now we have some sympathomimetic drugs which are used in the treatment of glaucoma, and these drugs are epaclonidine and brimonidine. They activate the alpha 2 receptor, and as we know that alpha 2 receptors are basically a negative feedback system, and they reduces the effect of norepinephrine as opposed to all other of the adrenergic receptors, which increases the secretion of, which interact with the norepinephrine. So this receptor, it decreases the secretion of the norepinephrine in the presynaptic membranes. So by this, it decreases the intraocular pressure. Intraocular pressure is the pressure that is inside the eye. We can see that this is a normal eye and there is no pressure, and in this we have a lot of pressure inside the eye because of an increased production of the aqueous humor in the eye. So these drugs, they decreases this intraocular pressure, and by this way they are used in the treatment of glaucoma. Next is the cardiovascular system. The sympathomimetic drugs, they are widely used in the treatment of shock. Shock is a condition in which the blood pressure falls beneath a level that is necessary to maintain the perfusion in the organs. We have a the patient has the patient comes in a hypertensive state. The blood pressure of the patient will be less than 90 by 60, and because the blood pressure is too low, it does not reaches the vital organs, it does not reach the brain, and when the circulation of the brain is compromised, the patient will come in an altered state of mental health. The patient will not be in his senses, and there will be decreased production of the urine or no urine at all, which is also called as oliguria. And because of decreased blood supply, there will be an increased production of the acids in the body, and the patient will have metabolic acidosis. The formal definition of shock is that it is a complex and it is an acute cardiovascular syndrome that results in the critical reduction in the perfusion of in the vital organs and a wide range of systemic effects. So the patient will have hypertension, the BP of the patient will be less, and the patient will have an altered state of mind. The patient will produce very little or no urine at all, which means that the kidneys are the perfusion of kidney is compromised as well, and the patient that there will be an increased production of acids in the body, and these acids are usually lactic acid, and the pH of the blood will be less, which will tell that the patient is having acidosis. So there are sympathomimetic drugs. They are used in the treatment of shock. These drugs include norepinephrine. It is very widely used to treat the shock and low BP. We use epinephrine. We use phenylephrine. So all these drugs and midodrine, they are all used to treat. Midodrine is not used to treat the acute shock. In the acute shock, we use these drugs, but it is also used to treat the hypertension. It is also used as a vasopressor. So the blood pressure in the body, it is maintained by two major mechanisms. We have the heart and the blood supply. So this is the blood supply. This is the heart. This is a very simplified and very rough diagram of the circulatory system. And there we have some vessels. Both these, they combine from the blood pressure. As we know, the formula of blood pressure is cardiac output into the heart rate. Sorry, it's cardiac output into systemic vascular resistance. SVR is the systemic vascular resistance. So cardiac output is the output produced by the heart, and the systemic vascular resistance is imposed by the vessels. When the heart it is beating with a more force of contraction and the rate is high, the blood pressure is increased, and the vessels, when they are contracted, they increases the preload to the heart. They give more blood towards the heart. So the systemic vascular resistance is the resistance in these vessels. So when these resistance is increased, or when the vessels are contracted, the blood pressure is increased. And likewise, when the cardiac output is increased, the blood pressure is also increased. So in the setting of low blood pressure, we use all these sympathetic drugs, because these sympathetic drugs, they increases the cardiac output by having a positive chronotropic and positive inotropic effect, and they also increases the systemic vascular resistance by causing the contraction in the blood vessels. So this discussion, it went a little beyond the scope of this. So now we have I've also discussed this here, that we have these vessels, and when there is hypotension, there is a loss of vasomotor tone. So we have alpha receptors here, and whenever any sympathetic drug is given, the alpha receptors are contracted, and this causes an increase in the vasoconstriction. When the vasoconstriction, the preload is increased towards the heart, and this causes in an increase in the blood pressure. See, we have these vessels here, and they have lost their tone because of, in the state of shock, because of any inflammatory mediator or whatever the reason is, and when we increase them, the blood pressure is also increased. So the sympathomimetic drugs are also used in the setting of cardiac arrest. We used epinephrine. We used epinephrine in the setting of acute cardiac arrest. So this is a drug of choice in this situation. Epinephrine, it is the only drug that is used in the setting of ACLS regardless of any rhythm. The sympathomimetic drugs are also used in the treatment of gingival bleeding in the setting of hyperplasia. And how they stop bleeding is that they constrict the alpha receptors. They constrict the alpha receptors, the blood vessels are constricted at the point, and the bleeding is stopped. A similar mechanism is seen in the setting of epistaxis. We use epinephrine topical, and this causes the constriction of the blood vessels and the bleeding is stopped. So they have also application in the gingival bleeding and the epistaxis. Next is the respiratory system. Beta 2 selective drugs, which includes albuterol, metoprolol, and we have another drug, terbutaline. These are the beta 2 selective agonist, and they are used in the treatment of asthma. These are the short-acting preparations can be used only transiently for acute treatment of asthma, and for chronic asthma we have long-acting beta agonists. They are used in the addition of steroids. They are also used as a decongestant. We use xylometazoline and oxymetazoline in the setting of congestion. The drugs used are oxymetazoline and we have xylometazoline. In the genitourinary system, we have a drug which is called as mirabigon. This drug, it interacts with the M3 receptors and it is used in the treatment of urinary urgency. In the genital system, beta 2 agonists are used to relax the uterus and to suppress the premature labor, and in this regard we use two drugs, ritotrine and terbutaline. These drugs are used to stop the premature labor. In the central nervous system, we have drugs, the reuptake inhibitors, amphetamines and modafinil. Amphetamines are used in the are used as a mood elevating drugs, and modafinil is used in the treatment of narcolepsy. Narcolepsy in which the patient actually sleeps in the days. Amphetamines, they are used in the ADHD, attention deficiency hyperactivity disorder, and they have a positive impact on the mood of the patient. We have a drug which is called as dexmedetomidine, and this drug is used as a sedating agent in the setting of ICU when the patient is very anxious or agitated due to any reason. This drug, it acts on the alpha 2 receptors. It's an alpha 2 agonist. This was all about the clinical uses of the sympathomimetics.